You can have all sorts of side effects on naltrexone, especially if you kind of rush into it. If you take a full or double dose, and that's the first time you experience it. You generally say start low, go slow. So start with like a half or a quarter tablet and use like the first week to kind of ramp up to the full 50 milligram daily dose. Most people won't have much issue with that and can kind of safely and comfortably start naltrexone and within a week be on the 50 milligrams a day. That's the most common experience. But there are a long list of possible side effects. They're just not very likely in any one individual. And usually they get better over time. And if you kind of ramp up slowly, they're much less likely to occur. But taking it with food or drink or after a meal is probably the best way to do it. You do kind of acclimate and get used to naltrexone. Headache, kind of flu-like symptoms, those are not uncommon. We generally tell you to try and not be drinking or to drink a lot less when you start naltrexone. You can start it while actively drinking. It's just if you're actively drinking and you're kind of waiting for the pill to flip a switch. In some cases that will happen and you won't want to have the next drink, but in other cases that probably doesn't let naltrexone have as much of a chance to kind of help you make benefits. People are going to have different experiences on it. Trial and error and sticking with it is usually the best approach. Even if you've had some side effects or kind of odd reactions early on, those usually don't continue, and this can often and more likely be a part of the long-term recovery process, but that also takes a lot of learning and changes up front that can be hard to do and not always feel great.